All right. Good morning, everyone. We are at the EMS council meeting today at 10:30 a.m. Just a reminder that this meeting is being recorded. Everything shared in the room as well as online becomes a part of the permanent recording that is posted to the two department's websites. If we can go ahead with roll call, please, Shelley. Good morning, everybody. Brian Smith.
Present.
Brian Stevens.
Present.
Chris Albino.
Here.
Dale Woolridge.
Present.
Dan Sate.
I'm here.
Deborah Grande.
Present.
Edgar Bissonette. Franco Castro-Marin.
Here.
Leo Bradley. Present. Garth Gamer.
Present.
Glenn Patrick.
Present.
Heather Miller. Howard Reed. Steve Godsinger.
Present.
Debbie Thorne. John Maida.
Present.
Nick L.
Present.
Ray Ochoa.
Present.
Rod Reed.
Present.
Roy Ryle.
Present.
Sarah Parati.
Present.
Shari Brand.
Present.
Phoebe Merrill.
Present.
Todd Hermio.
Present.
Vince Martinez.
Present.
Vivian Gellert. Oh, got to Vince. Thank you.
Vivian Gellert is present.
Thank you. We have quorum. Excellent. Thanks very much, everyone. And Deb, we did capture you. I saw your note in the chat as well. If you joined the meeting late and are a meeting attendee and on the roster, please let us know by raising your hand and we will make sure we capture your attendance on the meeting today. The attendance report in your packet does include everyone's attendance record. Just a reminder, if you missed 2 or more consecutive meetings, Shelley will reach out to you to confirm if you still want to participate in the meeting. We would like to welcome 2 new members to the committee today. The first is Dr. Jonathan Badum. Welcome, Dr. Badum.
Thank you so much.
And next is Brian Stevens. Welcome, Chief Stevens, as well.
All right. Thank you.
And then we have 1 reappointment, Sarah Parati, representing SAMES. Welcome back, Sarah.
Thank
We have currently 5 vacancies. There are 4 public members, a physician specializing in emergency medicine from a local EMS coordinating region, the Western region. If anyone has an expiring term or is interested in filling a role, the application is on the governor's website. There is a link on the agenda to apply for this. And note the 4 regional emergency physician roles also serve on the medical direction commission as well. So those 2 positions are linked with one another. I just want to do a brief update on the naloxone leave behind program before I hand it over to the bureau report. I wanted to highlight, if you look here, as of September 16th, we have over 2,800 EMPTs trained in the state of Arizona. To give you an idea that it's over 10% of the entire EMPT volume within the state is trained on naloxone leave behind, which is pretty remarkable. It's a really great work to Dave Hansen and the team for that. We have shipped out almost 2,600 kits shipped. We have 39 agencies who are participating across the state of Arizona and 318 kits that have been scanned and given out in the community. Just to identify, we recognize there are probably more kits that have gone out than have been scanned, just because people may hand a kit out and forget to scan that QR code to record the data. But really excited to see this program continue to build and more naloxone get out there in the community to address the opioid epidemic. So thank you to everyone who's participated with your agency, and thank you, Dave, for all your work with that. Next, I will hand it over to Chief Garcia for the bureau report. All right. Well, good morning. We'll go ahead and do a very quick run through of our bureau report slide. And just skipping ahead,
We are going to go ahead and share some EMS portal changes that are coming soon. As a reminder, the council will see this reminder, I'm sure, over the next year as we go through some EMS portal changes. One thing to note is that we're getting ready to sync up both the EMS portal licensing management system with Elite. That is all our patient care records, and there are some benefits for agencies that are interested in doing that we will be sharing out with all of our council members. We also have a change in the email address correspondence through the portal. So if you are an EMCP or an agency that uses that portal, please be advised that the new email address correspondence is going to be coming from an imagetrendslicense.com email address. And we'll be socializing that email address in the coming months just to make sure everyone knows that they have to make sure that email address is marked to go through your spam filter. We don't want your spam filters stopping those reply emails. Keep in touch with us. And then finally, we're getting a new logo. ADHS in the state of Arizona are going through some rebranding over the next year. So if you start to see our logo change from the square red icon that you're used to an AZ logo that's more copper and gold or turquoise, you'll know that really is us. It's not spam. So we'll keep sharing those reminders that those EMS portal changes are coming soon, and you'll get some email blasts and updates from us. Next up are our legislative and rulemaking updates. Really quickly for EMS Council, I will highlight House Bill 2033, which went into effect over the weekend. This is a bill that requires EMR training programs are submitted to the department for review. And it also clarifies ambulance staffing and billing requirements for interfacility transport. Nothing really new there, just some clarifications to be aware of. And for anybody that is interested, we have our updated statute and rule book that is posted on our website with that revised language. We'll keep moving to some rulemaking updates. The council probably knows these rulemaking updates better than anyone, but we have 4 rulemakings that were completed in the last 2 years with large participation from stakeholders across the state. We now have 3 pending rulemaking to draw attention to, and on the next slide, we have some links to those rulemaking resources where you can go to and you can see some updates. Our ADHS website does provide both updates on what has been filed so far and those opportunities for public comment. So if you're interested, please check it out. There's still a couple that are ongoing with opportunities for comment. The one that we wanted to highlight today is that the EMS and critical care scope of practice that was previously approved by Medical Direction Commission, that one has been approved and that one has gone forward already, thanks to our Medical Direction Commission. And so that will go into effect January 1st, 2025. But all the others, if you're interested, please check out. If you would like to submit comments or have any questions, I am listed as the department's contact person, so reach out. Next up, there are just a few slides that I won't go into detail on, but they will be in your packet for today's meeting. We have some updates and a summary on what is new in Article 9. Those are our CON rules. And going to the next slide, we have our annual reporting checklist for all certificate of necessity holders. And finally, this next summary slide, it has a link to our statutes and rule books, our checklist for annual reporting, and our checklist for ground ambulance inspection. So if you are a certificate holder and interested in those resources, please check them out. Those are links that'll take you to those resources right on our website. And then I will fly through some additional updates. One thing we wanted to highlight today that is going to be a component in the strategic plan that will be presented today is our EMS operating fund revenue, expenses, and cash balance. This is from 2016 to 2026. This slide really illustrates that this is a fund with decreasing revenue over the last decade. From left to right, if you look at that blue color, you see from 2016 to 2024, that is the revenue that came into this fund. From 2025 to 2026, that is the projected revenue for this fund. Similarly, the expenses are in that orange color. From 2016 to 2024, those are the expenses that were recorded during that time frame. From 2025 to 2026, those are the projected expenses based on the appropriation that we received from the legislature. Then we have cash balance. Again, 2025 to 2026, those are projections based on, again, our expenses and appropriation. If we were to continue to expend at the level that we are appropriated funds, you see that our cash balance is projected as negative. I can assure you that the Department of Health Services do not intend to spend all the way up to our appropriation. We will limit and cap our spending this year, of course, below our projected revenue, so that we will not have a negative cash balance in the coming years. But this slide is really important so that all of our council members can see that EMS operating fund does indeed have a decreasing revenue. That revenue is based on moving violations and the fees associated with moving violation. So the joke that we've been sharing as we've been socializing this with our 4 regional councils is that if you really want to do your part in Arizona, please speed and please get pulled over. That is how the revenue gets replenished here in the state of Arizona. But all joking aside, we've had conversations about this declining revenue with all 4 of our regional councils. We've made them aware by statute, at least 8% of the fund is allocated to our 4 regional councils to support EMS training and equipment needs across the state. You can see by the numbers that are on that slide that with declining revenue, we will unfortunately not be able to share as much money in the future with the 4 regions. And we will continue to share updates on this so that everybody is aware of how we're doing with this fund moving forward. We'll keep moving through the presentation, and just so you guys know, there's some additional naloxone leave behind info in this slide. We also have Crash Responder Week that is coming up November 18th through the 22nd. And thank you to all of our partner agencies that work with us on messaging around this each time of year. We will be working with Dr. David Harden to push out some messaging for this year's theme, which is reduce your speed as you proceed. And if you keep rolling through the slides, I think there's just a couple more nods to our EMS and trauma system strategic plan, which Julia will cover in greater detail as an agenda item later. I really just want to give a shout out to all the council members, regional councils, and agencies that participated in this process. And I believe we'll acknowledge them a little bit more later on too. But going on, there's some share update, which I will not do justice. Julia, anything to add here on share?
No, just that we're working with hospitals to renew their status currently, and then also continuing to work on the data piece so that we can work on report.
That will be in your packet as we push these out. And then some shared data elements and the timeline to be aware of. In the next slide.
Sorry, just to highlight this, I want to make sure everyone is aware. If we can go back, this is the update that EMS Council voted on at the last meeting for the additional data criteria to remain a premier EMS agency or PEEP agency. So these are the additional data elements specific to out-of-hospital cardiac arrest. So we will start running this data. That data collection will start in January. At the end of March, that report for that first quarter will be used to decide whether or not EMS agency meets that additional criteria to maintain their PEEP status. So if you are a NEMSIS 2.5 compliance software, which all of them are, your agency is able to do this. You just may need to train your personnel on the importance of data collection with this. So that's why we've really tried to get some messaging out and as many different formats as possible to say this data is consistent with national standards with NEMSIS 3.5. But really just making sure your personnel understand the importance of why we collect this, which is really to improve outcomes for out-of-hospital cardiac arrest. And so these are the data elements this group voted on at the last meeting, and this will now be kind of going into effect starting in January. I just wanted to highlight that quickly.
Thank you, Dr. Bradley. And since our next meeting for EMS Council is January 30, we'll be 30 days in by then. Correct. The new data elements. So thank you. We'll also have the excellent links shared in the packet that have our GIS data applications that have been worked on by Mr. Mike Hamilton, to my left. We have some really cool data sets that are available, so please check those out. And we can circle back if we're going through the strategic plan and needs assessment a little bit later, but we'll keep rolling. The National Registry updates are here for your light reading if you would like. We continue to work with the training programs on the psychomotor exam that is now in place through the state and Dr. Dan Mojo. So if you are a training program and have any questions, please reach out to him. Next up, we have our dashboard update. And I think this is where I'll just remind everyone that we shared some previous updates in our meeting earlier this morning on STAB. The STAB report and updated trauma dashboard will go live by October 1. So if you weren't able to listen in and see that preview this morning, it will be published on our website with refreshed data October 1. And then the next couple slides are just about our Arizona Trauma Registry transition, if you would like to read up on that. So thank you very much for allowing me to give the zero report this morning. I'll go ahead and turn it back to you, Dr. Bradley.
All right, thank you very much. So next on the Standing Committee and Regional Council report, Dr. Merrill, do you have a check your reports?
Sure, just making sure I'm all set. Thanks for having me. So just a brief report from the TEPI. We reviewed that there was an issue with ESO changing products. They'll be finishing out their contracted term, waiting on an announcement of the RFP bid. Winner for the next trauma database contract is still undergoing a bid review process. The minutes were approved. We reviewed the CON checklist, including resources for stakeholders, voted to approve the updated criteria for cardiac receiving and referral centers, in addition to reducing the CEDAR data fields. We received a background update from Rachel on the EMS trauma data that's available publicly, as well as some discussion on county-specific data requests, as well as reviewing heat-specific, heat-related illness data dashboards. So that's all I have. If there's any questions?
Thank you, Dr. Merrill. Next up, Brian for Education Committee.
Right, good morning. At Education Committee, the March minutes were approved as presented. There was a approved updated CPR training. They're going to plan to revisit that in a year for shared data graph updates. Voted to approve a joint work group with PACES to update safe sleep training. There were a number of volunteers for that. Voted to approve forming a work group to create TXA training. There were a number of volunteers for that also. They're scheduled for their first meeting on October 3rd. Dan discussed the new process for skills testing in Arizona. He welcomed program directors to an online meeting that occurred August 30th. The Bureau shared a recap of where we are with new scope of practice rules that will be effective January 1, 2025, and updated training program rulemaking. And there was an individual during the call to the public, Jonathan Epstein with the American Red Cross Training Services, inquiring as to this, whether their neonatal advanced life support training program would meet the rules for inclusion and training, and the Bureau staff confirmed that their program fits, such as option and rule language changes were not needed. PMD, I'll move on to PMD. The March minutes were approved as presented. There was the May special session minutes were approved as presented. Dr. Bradley shared update and guidance for OB preeclampsia and gestational hypertension recognition and treatment in the field. Table 1 was approved as amended, and that will go to MDC this afternoon. Approved creation of an annual review of drug tables, and there will be rolling acceptance of suggestions with an annual drug table update for the director to sign in the summer. Table 3 was approved as amended and goes to MDC this afternoon also. Thank you.
Thanks, Brian. And next we'll go to our regional council report. We will start with the central region. I know we had a written report in the packet. Roy, is there anything you'd like to highlight?
No, Dr. Bradley, thank you very much. I will defer to the comprehensive written report.
Thank you. Next for same, A.R.S.
Thank you, Dr. Bradley. In addition to our report, I just wanted to make sure that we highlighted our appreciation for the Bureau so proactive and early and consistent in communication with us about the budget, and advocating for us, as well as, communicating the constraints. And we really appreciated the in-person visit. So thanks again.
Thank you. Next for name, Vince.
Good morning, everyone. I've submitted the names report if anyone would like to read the details of our meetings and the great work we're doing up here in Northern Arizona. Other than that, I will defer to that, and our next names meeting will be November 1st. Thank you.
Thank you, Ben. Next, the Western Region, Ross.
Good morning. I'm sorry, I don't have a written one. We're currently still taking provider assistance applications from our member agencies for this year. We have recently graduated, we should have graduated 8 AEMTs and 15 paramedics will be coming up pretty soon, of the ones that were scholarshiped through the state funding. Unfortunately, it's wildfire season, and some of them were not able to, or are on the road. So we'll get those all done here pretty quick. Our next meeting is November 14th in Yuma. That's all I have.
Thank you, Ross. Next up for cases, Dr. Woolrich.
Yes, hello, thank you. We had our July meeting with quorum, and we had a series of voting items. We voted to approve our prior minutes. We reviewed our bylaws, and we added a mission statement. That mission statement was voted to be approved and incorporated into bylaws. We had a couple of presentations. Abriana presented on the EMS for Children program. Antonio Hernandez presented on statewide drowning data. We reviewed that. We had Ann Stafford with the Arizona chapter of the American Academy of Pediatrics, gave us background and presented updates on the Pediatric Prepared Emergency Care Program for Arizona. We also reviewed our new pediatric recognition program that's rolling out, and now coined Making Arizona Ready for Kids program. That's the MARC program. That the structure of the MARC program for recognition was reviewed, and the PACES Pediatric Advisory Council voted to approve that. Our next meeting will be on November 21st. Thank you.
Thank you, Dr. Woolrich. All right, next we'll move to our discussion action item. First, if I can get a motion to discuss and approve the meeting minutes from May 16th, 2024.
So moved. Second.
All right, thank you, Dr. Cameron. Dr. Zinker. All right. As we scroll through those, we make sure we get to the picture at the end.
Abstain.
It was not even on there.
That's how I like it. All right. Any recommended amendments to the minutes? Hearing none. Any opposed? Any abstentions? All the, thank you, Dr. Tomato. All those in favor, say aye.
Aye.
Next, we have our big item for today's agenda, which is to discuss and amend and approve the draft 2025 to 2030 strategic plan. Can I get a motion?
So moved.
All right, I hear a first and second from Dr. Meadham and Brian Smith. Thank you both. All right, and I will hand it over to Julia to go through this.
Dr. Bradley?
And Julie's bringing this up. I just wanted to really highlight, it is in your packets online that you received the agenda attachment. It is a lengthy attachment, but it's really worth when you have a little bit of time scrolling through. There is a remarkable amount of information, and a huge thank you to Julia and her team and Mike Hamilton and everyone that participated in this project. It's really a wealth of information about the EMS and trauma system across the state of Arizona, and very well done. Thank you.
Dr. Bradley? Yeah, so I'll start with a couple of slides and then we can kind of go into the document, but as Dr. Brett mentioned, the document itself is over 100 pages, and that's simply because there are a lot of maps at the end. So the bulk of the document is not quite that large. Up here.
The maps are awesome.
They're
The maps are
awesome.
So just quickly, today's objective just and present our EMS and trauma system needs assessment report and strategic plan for EMS council approval and adoption. Just a little bit of background, that is in statutes that the Bureau of EMS shall develop an annual emergency medical and trauma services plan and submit that plan to the council, meaning EMS council, for review and approval. This will then be submitted to the governor for a final adoption. So that's kind of where we are today. We're presenting this plan that we've been working on for several months, and hope that we'll be able to share this with the governor. So just a quick recap of the process. We have been working on this plan for quite some time, starting with our needs assessment survey back in 2023. We conducted some focus groups and looked at the data that we collected earlier this year. We had our strategic planning summit, and then use that information to kind of elaborate on our plan, presented that with the regional council throughout August, and then here we are today. So looking forward to the future, the plan's tentative start date is January 1st, and at that time we'll be looking at forming task force groups and things like that to look at each of the strategies so that we can start working on some of the objectives for that. So just quickly, some acknowledgements. We really could not have done this without each and every one of you and all of the associations and regional councils that participated in the planning process. This is a huge thank you to everyone for your participation in that. So let me just switch over to the document itself here. I won't go through every single page, but just here you'll see we have our table of content, our introduction, acknowledgements again. This is just again the process that we had used to get to this point. So as part of our needs assessment, we did some little infographics that kind of look at the Arizona EMS and trauma system overview. So this is just information about the Bureau. This is an EMS and trauma system snapshot. The information on some of these snapshots is likely a little bit outdated just because it was created a couple of months ago, not necessarily today. So keep that in mind. We'll be looking at updating these on an annual basis. And then we get into the needs assessment web applications and map, and I will turn it over to Mike Hamilton, our GIS. We'll back to that.
Okay, good morning. Can I share my screen? Okay, good morning. What we wanted to do is we wanted to add a little bit of a geographic component to the needs assessment report. I am going to say in my defense that they asked for all the maps. So I didn't just go as crazy as it looks like I did. So what we wanted to do is we wanted to look at all the GIS data sets that are available right now to incorporate and to kind of compare. We have all the licensed healthcare facilities, the EMS regions, hospitals, designated trauma hospitals, cardiac care hospitals. Let me get to where I can see it here. Cardiac care hospitals, CONs, and EMS stations. On the bottom of each of these little tiles there, you can click and it brings up a list of all the appropriate facilities there with names and addresses and lat-long coordinates and all that fun stuff. Again, you guys will have links to all this stuff. Please go in, open click, and do everything you want and see what's in there. So the next portion we have there is each of those different items also has a map. It's an interactive map. You can zoom in, you can zoom out, you can turn layers on and off. You can add all the different layers, and everything on the left is just text data. So we have that for the facilities, we have that for the CONs, for the hospitals, trauma facilities, cardiac care centers, CONs. And again, you can just go in here and you can click on one and let it catch up, and it'll give you that information associated with it. And at the bottom or at the very end, you can also come into and click on a county. We'll do Pinal. And what it's going to do is it's going to pull up specific information for that county. So this one right here, it's going to tell you all of the different CONs, all of the different hospitals, designated trauma hospitals, cardiac care, and all of the different EMS stations. Each one of those can also be exported to CSV. And down at the bottom here, that's kind of a little bit of a complicated. There's a lot of different components, but there's a link right there that takes you to a real simple, these are the layers, this is the map, turn things on, turn things off, drag it around, zoom in, fun stuff like that. And finally, all of the data is public data. So if you want to download it, use it, whatever, there's a link right there on our Open Data Hub. And please feel free to give me a call, email, and I would love to work with you and we can custom make and filter out some information. And that is all I got. Let me stop sharing there, Julia. There you go.
Fantastic, Mike. Thank you.
Yeah, great work. And if you do take an in-depth look at the map at the end of the needs assessment, that will be just kind of static versions of the information that's on the online graphs of dashboard. So thank you very much for sharing on that. So next question. Oh, yeah, sorry.
Thank you for that. I appreciate it. Do you, to download and I'll call it, absorb the file, do you have to have GIS software within your device?
No, but can we talk about it and I'll show you specifically how to find what you're looking for and maybe find out what format you're looking for.
So for example, like the file itself. So if you wanted to download and take the file, again, it's public information, right? But to be able to utilize the file and create, I'll call it another GIS mapping software.
It's available in shapefiles.
Shapefiles.
Yeah, it's available in CSV stuff. There's lots of different options. So again, yeah, let me know how I can help you and we'll get you what you need.
Perfect. Thank you.
You bet.
Thank you. So as we go through the needs assessment piece, we also were able to develop regional profiles that again compile some of the information from the map with some of our licensing management information and things like that. We also included the information from the Arizona Social Vulnerability Index, which is posted on our website. So on this document, there's county level information for each region.
I wanted to really highlight this. If you look at number one, Julia's amazing was her infographic that she put together. So the snapshots that get put together for our common EMS snapshots, those are Julia's work every year. But if you look at this at a regional level, for each regional council, you can really take this information and kind of get a very quick look at what your system looks like. And so it's important, as Julie mentioned, the social vulnerability index. You see huge variation there amongst the different counties across the state of Arizona. And that really is in regards to availability to healthcare. And so recognizing the impact of EMS in those communities. So I wanted to just highlight, I know it's a big pack of information, but really, for, take some time to look at your region, look at your county specific. This is a great tool that you can utilize, you can share within your region. And I think it's easily digestible for everyone. I just wanted to highlight those.
Good job, Julie. That's right. And again, these are something that we would look at updating on an annual basis because of course, that these numbers aren't permanent. So, all right. And then next up is, I think, some of the interesting part essentially is our strategic priorities. So we really brought some basic priorities to our strategic planning summit back in April and use that time to identify some different objectives and strategies and things like that. So here we have our 5-year strategic priority. So I'll screen here. So we have dispatching and time-sensitive illness and injuries, registries, data and reporting, financial instability and resource needs, and then workforce development and training with an overarching emphasis on resiliency. And if you look at this document itself, here we have the goal for each strategy, along with our related ADHS 5-year outcome, and then also related EMS 2050 guiding principles. So those are just kind of there as resources and kind of looking at where some of our strategies fit in a bigger picture. All right, so strategic priority 1, dispatching and time-sensitive illness and injury. The goal here is to reduce death and disability of Arizonans who experience time-sensitive illness and injury through evidence-based practices, education, and data-driven continuous quality improvement. So you see here our objective. Actually, can I switch back to the slide? That might be a little bit easier. I'm going to switch over to the slide that makes that a little bit easier to see here. Okay, so this is the same information. Objective 1, relaunch the State of Heart in Arizona Registry and Education, add a possible cardiac arrest data and community education program to improve cardiac arrest survival. Objective 1.2, establish guidelines for emergency medical dispatch / pre-arrival instructions for dispatchers and layperson responders to improve outcomes. 1.3, promote Stop the Bleed and naloxone leave behind programs statewide. And then objective 1.4, promote injury prevention through highway safety and post-crash care. So many of these are projects that the Bureau has kind of already been working on and is really looking to take to the next level.
And if I can highlight of how this overlaps with, when you look at the actual practice, you see the action steps. As Julie said, many of these are programs we have been working on, but some of this we're really looking at how do we take the next step, recognizing that as we have those building blocks that are in place already, what can we do to kind of take those next steps to further the outcomes and not just practically.
Yes, thank you. So for example, for objective 1.1 with the share program, some of our action steps include we established annual cardiac receiving and referral center meetings and or user groups, develop an out-of-hospital cardiac arrest dashboard similar to the other dashboards hosted on the Bureau's website, improve quality and automaticity of pre-hospital cardiac arrest data elements, and then let's see, explore opportunities to link existing hospital data for the purposes of cardiac arrest, explore opportunities to streamline and enhance the usability of the AED registry, which is something that ADHS also oversees. Relaunch the Heart Safe Recognition Program to engage communities in improving outcomes from out-of-hospital cardiac arrest, and then support law enforcement and community-based organizations in identifying funds for AED. So look for grant funding or other internal funding. For established guidelines for emergency medical dispatch, we'd like to identify the number of Arizona dispatch centers that are already implementing pre-arrival instructions for dispatchers and layperson responders. Formal work groups to develop guidelines, explore opportunities to provide training, dispatch and PSAP, and then engage the ADOA PSAP program and strategies to increase the number of dispatch centers implementing pre-arrival instructions. And then Stop the Bleed and naloxone leave behind programs. We just would like to continue promoting EMS and fire agency participation in the Bureau's programs. Not Stop the Bleed as an evidence-based program to stop severe bleeding, and then explore opportunities to include Stop the Bleeding in high school curriculum, kind of like CPR. And then lastly, for highway safety and post-crash care, we'd just like to continue partnering with the Governor's Office of Highway Safety and the Arizona Department of Transportation to improve safety and outcomes, utilizing best practices associated with post-crash care.
And one of the things that we have highlighted with this is that there is a large amount of money available federal level that is specific to jurisdictions. So you have to be a jurisdiction to apply for those funds that are through the Governor's Office of Highway Safety. So one of the pieces that we recognize is how can EMS apply for that, and that it's specific to post-crash care. That is the term that is used at the national level, that there's quite a bit of communication that comes from the SEMSO, the National Association of EMS Officials, that comes down to the different state EMS offices to really get that messaging out to EMS agencies and jurisdictions across the state. I know we do have a few in the state that have started to get some of that funding, but just wanted to continue to get that messaging out there. There is quite a bit of funding available, with the focus being specific to post-crash care and how can we improve outcomes with that funding availability.
All right, so our second priority area is registry data and reporting, and our goal here is to improve EMS and trauma data quality and stability through the use of innovative strategies and production. So objective 2.1, as many of you know, we're already working on this, implement a new Arizona State Trauma Registry to monitor and improve injury outcomes. So we're currently in the RFP process, as many know already. So we hope to finalize a contract with a new registry vendor and then develop implementation education resources for your trauma center. Objective 2.2, develop and maintain EMS and trauma dashboard to monitor call volume, response times, and resource levels. So something that we are working on here at ADHS is to enhance our dashboards from one platform to another, so that's reflected here. And then also work with the ADHS team to increase the number of dashboards and GIS information on that. Objective 2.3, update the EMS and cardiac registry to streamline reporting and provide real-time reporting. So this is to hopefully reduce the burden on hospitals for submitting data, specifically with the SHARE program and other programs, but explore opportunities to link existing hospital data again to easy peer to reduce burden on hospitals, and then explore opportunities to utilize the unique universal identifier with trauma and EMS. Our third priority is financial instability and resource needs. As Rachel had kind of shown the budget snapshot earlier, and we know that that is a priority that we need to be looking at over the next several years. So our goal here is to ensure the financial stability of the Arizona EMS and trauma system through reimbursement, the EMS operating fund, and grants opportunities. So just 3.1, monitor health and stability of Arizona's EMS operating fund and trauma funds. So this includes collaborating with the local EMS coordinating systems and associations to conduct needs assessment and identify funding opportunities to meet the needs as required in statute. And then monitor the EMS operating fund budget, expenditures, and cash balance to ensure that the needs of the EMS and trauma system are met over the next 5 years.
I have a question. So in the metrics column, a lot of these are recognized as perpetual efforts by the Bureau. We know that you update your data dashboard, and a lot of this is day-to-day business of the Bureau. This is kind of this is a sensitive subject for the regional councils, the funding, and when do the metrics regarding possible new sources for revenue for the Bureau? I know you're probably exploring what to do because I don't think that fund is going to be with the current source, the revenue source. I don't think that's going to be a sustainable thing. And the regional councils want to continue to do their good work, and AIMS employees and executive director who does a ton of work, and we'd like to keep her salary commensurate with what she's doing. But I don't know, at some point, if our funding falls below a certain threshold, we're going to have to go to part-time individuals and things like that. So all I'm asking is, what does that look like legislatively? Grants to the Bureau, grants to ADHS, grants to the regional councils, perhaps independently, and how is that all presented to this body and in the form of these metrics? So what do you think that should look like?
I think those are great questions. Part of the annual report that we will deliver each year to both the EMS Council and then the governor's office will include a budget component. And our job in between those annual reports with those annual updates is to get our action steps and metrics monitor as a fund on a monthly basis. And so we are looking at that very closely. We're also looking at other funding opportunities and perhaps what you might call like a braided funding model, where you would look at alternative funding sources like grants to support and augment the EMS operating funds. So I think there are opportunities in terms of what we've identified so far in this report. The spotlight is on the EMS operating fund. So we will have to look elsewhere, and we do want to continue those conversations, of course, with the 4 regional councils, because we share the fund by statute. So it's really important that we keep each other informed of what that looks like. And as of right now, we have a small amount of EMS for children funding that augments the regions, specifically almost pediatric. We together will need to look at additional opportunities.
And I think this is not all on the Bureau.
Hey, folks, excuse me, this is Dan Spate, but the volume in the system seemed to have just dropped a lot. At least it did for me. So if it happened for others, it's harder to hear you now.
At what point did you lose it? We back?
About 30 seconds ago, it just went a lot softer. You might want to see if others on that are calling in by phone have the same thing happen.
We can. Give us 1 second to just adjust the audio.
It's a system issue because I'm having the same experience as Dr. Spate.
I hang up the room audio.
All right. We're going to do a quick audio check. We're going to go back to my computer, which we used in the last meeting. How is the audio now?
Very good.
Okay, awesome. We will work this and I will get my steps in again. So it sounds like hopefully, did you guys hear Dr. Gamer's comments first? Let's start with that to see.
Dr. Gamer's gonna come sit over here so we can repeat all the brilliant remarks we just had. You guys missed our absolute brilliance.
This is Dan. I heard Garth, and probably have heard him as many times as I ever want to hear. So I'm hearing him great.
Well, thank you very little, Dr. Spade. But the only other point I wanted to make is this is not just on the Bureau. This is on individual agencies. Perhaps some lobbying needs to happen in the next legislative session, things like this. You know, this EMS operating fund appears to be non-sustainable with the current revenue source. So, yeah, I think the regional councils have no choice but to really work hard with the Bureau to come up with new sources of revenue. So,
yeah,
that's my point. And I think a lot of people within leadership of AIMS and other councils think the same way.
I'm going to just walk the computer over to Brian here.
So I think part of the answer is for a whole lot of EMS and other agencies to get together and go to the legislature and get that penalty increased to increase the fund. It's coming. That was supposed to, a lot of that money, that 8% is supposed to go to help regions and rural areas to be able to provide services to the highway. And that's why that fee came out with tickets. And I don't see any reason why we can't go to the legislature and ask for it to be increased. And then while that's here, do you want me to, I have a comment about one other area on here. Do you want to wait until we get there?
I'll come back. And because I see Dr. Woolrich has his hand up as well. Dr. Woolrich, go ahead.
I apologize. I think I hit the wrong gesture.
All right, never mind. Okay. Yes. What gesture were you going for? That's a new one on Google Meet. Are there any further comments on this section? And then if not, when we get to wherever you want to speak up, Brian, please let us know.
Okay. Okay. So please, if anyone has any questions as we move forward, feel free to chime in. Okay. So objective 3.2, review response times and financial impact on rates and charges. So our action steps here are just to review response times based on population density, geographic and medical considerations, and financial impact on rates and charges with ambulance services every 6 years, and then establish just, reasonable, and sufficient rates for the level of service provided by CO and holders. All right, and then our last major priority area is workforce development and training. So here our goal is to ensure a stable, supported, and well-trained EMS workforce that is adequately prepared, healthy, and resilient. So here we'd like to promote and sponsor rural paramedic and emergency medical dispatcher training. So again, here, this is an area that we need to do a little bit of work to identify some additional funding opportunities because over the last couple of years, we've been able to provide some money to the regional councils for supporting education, and we'd like to be able to continue to do that. There's that, and then update training certification and scope of practice rules to establish the EMR and critical care paramedics. So again, something we've been working on, work with the education committee, PMD and MDC to obtain feedback on the development of EMR training centers, critical care endorsement certification criteria, critical care training center requirements, scope of practice updates, and drug table updates to include EMRs and critical care endorsements.
If we can maybe just go back quickly one slide, I just wanted to highlight, there's two components. The Bureau was able to help fund the education for rural paramedics over the last couple of years, which I think has been a huge plus. One of the other things that we have identified as part of the SHARE program is how do we improve the dispatcher aided CPR instructions, recognizing that there's many parts of the state, especially in our rural countries, that have worse outcomes with out-of-hospital cardiac arrest, where those pre-arrival instructions are not given because of how the call goes to the 911 system. There aren't any dispatch instructions given. And so there are some programs that are done in other states. We would love to find some funding source to really support this, as we know that if we can get CPR done prior to EMS arrival on scene, that individual's chance of survival increases significantly. So when we look at kind of how the strategic plan and funding really improves outcomes in the state of Arizona, this is a very clear example that if we can get funding to help support this, this is work that the Bureau has done historically that we would love to be able to help support and promote.
And then lastly, for this workforce development and training, we have develop and certify EMS training programs in partnership with Arizona Department of Education, career and technical education programs in every county. So just something that we'd like to work on is collaborating with programs. So developing a list of the existing programs, developing a strategy to conduct outreach, and then conduct outreach in collaboration. And then here's just some updates on the critical care endorsement that's coming soon. That's related directly to this priority area. And lastly here, for resiliency, we, as an overarching objective, we really just want to make sure that we are contributing to ensure a healthy and resilient EMS workforce, and that probably primarily will be done by promoting and sponsoring opportunities related to provider wellness and resilience. So we would like to make sure that our resiliency website is up to date with resources that are out in the community, and then also partner with external stakeholders to promote resiliency and wellness. So if anybody is doing anything in this area, then we want to make sure that we're partnering with them and highlighting the work that's going on in the community. And okay, actually, sorry, I stopped talking. I'm going to switch back to the plan document really quickly. So as I should have mentioned this earlier, but as was mentioned, then there are metrics in the actual document itself, just to kind of relate to each of these areas. And so after that, we do go into the budget information. So this is the Bureau's operating budget for fiscal year 2025. Yeah.
And this is where my next.
Oh, okay.
Yeah, well,
Did you scroll down towards the bottom of that document where the whole kind of footnote?
Yes.
And it's down here. So down here in the last sentence of this, it says that as projected revenue decreases of fiscal year 2025 local allocations in each 4 regions is then read 442,000. But that's what we've been getting for the last 7 or 8 years. Unless we were supposed to be getting more, and it's only being reduced for this year. So that.
I believe Rachel corrects me. This was considering the extra $100,000 that we applied the last 2 years.
we were able to, the last 2 years, we were able to do, it was 842. Yeah, 142,000 to all the regions with the rural paramedics.
Okay, so you were
scholarships.
including 100,000. Okay, I got you.
Thank you for
I thought that was from the EMS fund. So
And I mean,
was that from the EMS? Was that 100,000 from the EMS fund? Or was it from somewhere else?
we were able to get additional funding to augment that to, yeah, to be very specific, it was not coming out of the EMS operating fund.
Okay.
But to your point though, I mean, this is more not good news, but if we continue to see a downward trend, if there are less moving violations and less revenue than is already projected, that number would have to be reduced even more. And so that footnote may need to be updated to be more accurate, that
the fund and the amount that is allocated to the EMS regions could be even lower, since statute only spells out 8%.
I've heard rumors about 26. So
I see Jesse Torres has his hand up.
Hi, everyone. Governor's Office of Highway Safety. I don't believe you're going to see a downward, well, actually, there is a downward trend on the number of citations being given out, but it's not due to lack of violations. It's due to lack of enforcement. So I'm hoping to get all the agencies back on track that traffic enforcement is a priority, and it should not be riding in the back seat anymore. They should come up to the front seat in the passenger seat. But it's a big push. Anybody who can help with that is surely appreciated.
Thank you.
So as we scroll down further in the document, we have the budget information that Rachel already mentioned. That includes the revenue expense, cash balance projections. There's a logic model that kind of is more of a big picture look at some of our strategies and some of the outcomes that we hope to see. And then as you scroll down, it just kind of gets into some of the survey highlights. So that's the needs assessment portion. We did the survey last year, and then we just included that information here for review as part of this document. And same with the focus group information and some of the top responses there. And then that goes into the county and regional maps. So, and that's, again, quite a few documents. But so that is the plan. I will put in the chat, we do have a link if you are interested in providing any, I guess we can have, of course, collect feedback now. Should I share the link? So we have a link if anyone's interested in providing additional feedback via a survey link. We do have a link that I will share shortly in the chat. And I think we'll have that open for just a little bit longer. We honestly haven't received, we've been circulating that link, but haven't received a ton of feedback there. But yeah, I think that's all that I have to share. Are there any comments or questions?
I have a question. Yes, when does the survey expire?
Rachel, when would you like to keep the survey open till?
Because we wanted to correspond, leave a survey open with EMS council's review and approval. Our goal is to close the survey either today or tomorrow. If there were any comments that the council members wanted to provide after the meeting, we can leave it open until tomorrow. It is a survey link that's been open for, I think it's been like several months at this point. And so we're hoping that after today, we can close that out with final comments from the council.
And if anyone wants to scan the QR code and do that real time, you can do that. I know often if you leave the meeting, someone forgets to do that, but that's available for anyone in the room or online. And one thing I just really wanted to highlight, similarly to the State Trauma Advisory Board and the STAB annual report, when you look at our maps, when we build a physical report that we hand out or print to individuals, you really are getting just a tiny picture of what that data looks like. And so we really are trying to get people to go to the website, go online, play with the maps, play with the dashboards, because you get an idea of how much information is actually buried in these. So certainly for kind of approval processes, we put it together in this format so the group can see what that looks like. But the real benefit is to go online, actually utilize these resources, see what data is buried in there. So just really encourage everyone, when you have time and are interested, just to please navigate there and review that information and provide feedback. So this is an action item on the agenda. So unless we have any further feedback or input from the committee, I wanted to see if the committee is ready to take a vote.
Chairman, motion to approve the 2025 to 2030 strategic plan. As presented.
All right. Thank you, Dr. Madam. And we had the motion on the floor before, so we're just reiterating the motion there. Is there anyone opposed? Please say nay. Any abstentions? All those in favor say aye.
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 All right. Thank you, everyone. We appreciate that, and we appreciate all of the work that has been done by Julia and her team, along with all of our regional councils and external stakeholders. So thank you very much. All right. Next, I think, Aubriana, I'm going to come over to you, and we're going to go to the next program here. This one on the other side. Yes, please. Thank you, Shelley. Dr. Bradley.
Awesome. Well, thank you all for allowing us the time to speak here today. I come representing the EMS for Children program within Arizona, but I also want to mention that the EMS for Children program is nationally funded. We are the only program dedicated to ensuring quality emergency medical services in both a pre-hospital and hospital setting for pediatrics. So with that, one of the ways, oh, not yet, Shelley's fine. One of the ways that we satisfy our grant deliverables is by having pediatric recognition programs. You may be familiar with our hospital one. We have the Pediatric Prepared Emergency Care Program. And then here today, we seek to present to you about our pre-hospital Making Arizona Ready for Kids program. Next slide. Thank you. Okay, so the Making Arizona Ready for Kids program, also known as the MARC program, is the first pre-hospital pediatric recognition program within Arizona. This was an EMS for Children initiative to improve pediatric patient outcomes. And one of the ways that we do this is through our federal partners guidance, as well as our adjacent states, EMSC state partners recommendations as well from their programs that they've already implemented in their states. And the reason why we wanted to have this program is to really support as well as recognize those pre-hospital agencies that are taking that next step to be pediatric ready. It is important to note that this program is 100% voluntary and it is at no cost for membership fees to be a member of this program. Okay. Oh, next slide, sorry. Awesome. And if we want to minimize it out a little bit. Perfect. Okay, so while we recognize that all pre-hospital agencies are dedicated to serving their community at the best of their ability, what this program wanted to do was really emphasize those pre-hospital agencies that have taken the assessments, have made sure to stay up to date with having a pediatric emergency care coordinator, and we just wanted to recognize those extra efforts that they are having. You will see that there is 11 criteria components within the application manual. We've condensed it down to 8 for when we're presenting this to agencies, just for simplicity's sake. Number 7 will encompass 3 of the ones on the application manual. I apologize for the confusion in advance. But the major components is having a pediatric emergency care coordinator. Does your agency have a pediatric equipment checklist? This is a given. We went with the state standards for what pediatric equipment is currently there. So we wanted to reduce that burden of time as well as resource allocation. So we didn't want to put that burden on pre-hospital agencies. In addition to this, we asked that they complete all EMS for Children surveys. Recently, we just had 60 agencies complete the pre-hospital pediatric readiness project, so they would be eligible. And then when that survey assessment period opens up again, anyone that participates would be eligible for it at that time. In addition to this, we asked for a policy for patient medication safety. For CON holders only, we asked for a policy for safe transport, and then pediatric CE annual training. Some feedback we received from our advisory council here at the state is we don't want to overcomplicate it by asking for more CEs. So we have gone with the national recommendation for ALS providers to have 4 pediatric CEs, and then BLS providers to have 2 pediatric CEs. Lastly, we have the partners with Families for Patient and Family-Centered Care. And then we also have pediatric disaster preparedness. So are you participating in events for mass casualty incident, family reunification? I see a lot of familiar faces here, so I know that you all are doing that. Next slide. So the program attributes, so as I've mentioned before, the MARC program is 100% voluntary, and it's solely reliant on all EMS and fire and rescue agencies' participation, as well as EMS agencies' leadership to uphold those MARC program standards. I do want to note that this program is non-putative. It does not cross over to the Bureau's regulatory responsibility under statute or rule. We're simply here to just support and as well as recognize those pre-hospital agencies that are taking that extra step. Next slide. So while there are many benefits of the MARC program, the most important, and I know this is to all of us, is those improved pediatric patient outcomes. You can see in the right that we do have a very rudimentary map that I hope our internal team, Mike, our GIS guy. Well, we hope to work internally to create a different pinpoint to recognize those pre-hospital agencies that are members of this program. In addition to this, we will be providing all members with a sticker. They are welcome to put that on their rig to inform their community that they are pediatric prepared, or they can just put it in their agency if they would like. Outside of this, they are able to share their MARC with other pre-hospital agencies by working together. In addition to this, they'll work with the hospital pediatric recognized program participants to facilitate collaborative opportunities as well as exchange best practices within the pediatric community. And then next slide, please, Shelley. So in addition to the feedback for the pediatric CEs, another feedback that we received from our Pediatric Advisory Council was the time commitment for filling out an application for enrollment. So we wanted to make it as simple as possible. It is a 2-pager fill out form. It can be printed or virtual, and it should take 5 minutes to complete. We only ask for the EMS agency's information, the pediatric emergency care coordinator, who's your medical director, and who's your agency director. I know the wording is very small in the compliance reporting form. This is an attestation form that can be accessed through the external program manual, which I see some looking at right now, and we will be talking about in a couple moments. But that really just highlights having a pediatric emergency care coordinator. Do you have your pediatric CEs for your agency? What are you doing for community events, and etc. Okay, and then next slide. So while we do not have the time today, I would encourage everyone to access this presentation and click on that picture. There is a video created by our federal partners highlighting some of the other EMSC state partners and how their pediatric program has improved pediatric readiness with a family actual live incident. So it saved the child's life, and they credit it to being part of the pre-hospital recognition program. So if you have time, it takes 3 minutes. Okay, so, and then we can just scroll over to the application manual. Thank you, Shelley. So this application manual through and through is 4 pages with a entry page as well as a thank you page. The first one highlights the introduction, which I went over in the slides, so I won't necessarily go through that, but it just highlights that this program is voluntary and the mission of the program. And then for recognition criteria, one slide, please. Thank you, Shelley. So we currently have 1 tier for recognition. That is our prepared advanced care. We're following a similar format compared to our other EMSC state partner program managers. They found that this works best for their agencies. It reduces that burden of the time as well as resource allocations. And then we have delineated down the list of the program criteria for our Arizona pre-hospital agencies based on the recommendations we've received from leadership as well as our Pediatric Advisory Council. So to help with that program criteria, we did create a supporting document checklist. Just go over, do you have a pediatric emergency care coordinator? This is typically the EMS trainer. It could also be the leadership within your agency, or anyone that's really passionate about pediatrics and just wants to help in any way, shape, or form. Going forward, they will act as a liaison between the EMS for Children program and their agency, and then once they arrive on scene, they can be helpful to those families as well. Education and competencies. We are asking for a list of the current personnel with their pediatric CE certifications de-identified, so we don't want to know all their names, but how many people do you have in your agency? Are they all completed with their CPs? And then copy of their process used for ongoing pediatric specific education. Oh, don't mind me, guys, my scroll just lost. And then their policy regarding their scope and frequency of education and skills assessment competencies. Reason why we ask this is because it's in our EMS for Children surveys, and most agencies have checked off yes, that we do have a policy in place for that. So again, reducing that barrier to entry, we wanted to help by having them be recognized for having that policy. Patient and medication safety, it's just asking for their policy for utilization of tools, as well as if they have safe transport of children, the CO1 holders only. And then the copy of the policy or for the equipment necessary for safe transport of children, again, for CON holders only. Then we go into policies, procedures, and protocols. We're asking for their pre-arrival instructions identified in EMS dispatch protocol, include pediatric considerations, as well as their copies of pediatric policies, procedures, and protocols in place. Any evidence-based guidelines or consensus-based guidelines that they use, they can often find that through our program. We have a plethora of resources for that available for all agencies here in Arizona. And then we have a request for a description of the pediatric oversight provided by the medical director, as well as those copy of transport policies regarding pediatric medical, trauma, and behavioral health emergencies, and then transfer at the receiving facility. So I don't know, do I necessarily need to go through every checkpoint in the list? Or?
No, I think it's
Okay.
all in there for the group to review. And then if people have specific questions, we can address that.
Okay, great. So I won't chat your ear off about that. Thank you, Dr. Bradley. Okay, so then just going to the timeline for award of recognition, this from the time they submit the application to the award, it takes about 160 days. When we do a virtual site visit, we're just going over the compliance attestations list, making sure that everything is in place. We're not asking each agency to pull it out. We want to reduce that burden of time for whoever's meeting with us, and make sure that we're just having everything in place for that pediatric emergency. We will be relying on our Pediatric Advisory Council during our March visiting session to review those applications. And then in April, we'll be asking for follow-ups on that. And then in May during EMS week, we will also be asking for an award of recognition event. And then they will have their recognition for 2 years after that. Hi, Dr. Gamer.
Hi, just a question.
Sure.
Is this a once a year timeline, or is this just an example of how long it takes?
So,
because agencies of a certain size, it might take them, a while to spool this program up. So we might say in June of next year,
Yeah.
we'll be ready to go.
No,
Okay.
that's a great question. So we do submit applications every January. So it's a year out from January that they can be preparing to apply for the program, and then the following January they can apply.
Okay.
And they'll have 2 years of recognition criteria or recognition for being pediatric prepared.
Understood.
Thank you.
Yeah. So January of every year.
Yes,
you want
sir.
it. Okay.
Yep. Thank you.
To your recognition.
Sorry, it was a tongue twister. I don't know.
Yeah.
Okay, so outside of that, we do have our compliance attestations list. I do want to reiterate that this is from federal recommendations as well as other EMSC state partner program managers that have implemented this program in their agencies and found it to be successful. Outside of that, we've gone through our Pediatric Advisory Council as well to get their feedback, and this is what we are presenting to you today. So if you have any questions regarding that, I would welcome them. Happy to discuss them. If not, the final page is just, saying a thank you to those pre-hospital agencies that are taking that extra time and that effort. I know everyone's wearing many hats, but we're showing our gratitude by saying thank you for being pediatric prepared in your pre-hospital agency. So that concludes the MARC program.
Thank you.
Dr. Bradley.
All right. I see Sarah Latham has a question in line. Sarah? Sarah, we see your hand raised. Oh, no. All right, we see, so I see Sarah trying to type in her comment. Thank you, Vince. Great program. So one of the things we do want to recognize is, while we're trying to make this as easy as possible, this is still a pretty high standard for agencies to meet. So our goal is to kind of see how this kind of rolls out, see what participation looks like, and then reassess within the next 12 months, see what are barriers for participation. Much like with any recognition program the Bureau has implemented over the years, these are always things that we look to improve and increase participation in. So we like to start with our kind of high expectations and then kind of adjust as we get feedback. So is there any feedback from the committee in terms of things that they could see as barriers or things that they like or have any concerns about? I will come over to you in just a second, Brian. I see a comment from Sarah that seems very similar to the PPEC in the hospitals. Would a base hospital be able to participate with an agency?
So typically the pediatric prepared emergency care program is our hospital recognition program. So we would recommend any base hospitals to reach out to our partners at the Arizona chapter of American Academy of Pediatrics.
I think your question though, Sarah, so in regards to the agency would need to be the one applying. So certainly as a base hospital, you could support their education, et cetera, if they need assistance building education protocols. But that is something that would really, it's an agency specific recognition as opposed to hospital. And I'll come across, Brian, to you. I snuck up on you.
So one of the things on here that see if I can find it here again. Yeah, copies of pre-arrival instructions identified in EMS dispatch protocols that include pediatric considerations. That's going to be tough for some of our rural agencies. They have no control over what may or may not be happening from their PSAPs. If that even happens and it's not getting rolled over to them, I think that's going to be a big hurdle to keep people that might otherwise be able to make some of these other things and not be able to meet that. So that was the only thing.
Great point, Brian. Yes, we do recognize that within the larger counties, we do have kind of primary and secondary PSAPs, and the secondary PSAPs provide EMD, but that in many parts of the state, the only instructions are via the primary PSAP, but there are no EMD available. So that is definitely recognized as well. Thank you for bringing that up, Brian. Sarah, I think I heard your mic off if you had anything to add.
Oh, is it working now? Yay.
Yeah.
Sorry, thanks. Yeah, I was trying to clarify earlier. I know that this is obviously the EMS, certification of preparedness, but it does seem very similar to the hospital side from the pediatric verification. So I guess my question was, would an agency be able to partner with a base hospital, for example, that's already gone through PPEC and kind of share resources? Or do you see this being way more specific to EMS without going through all of the bullet points?
This is 100% specific to EMS. Yes. So certainly the base hospital can assist in terms of if resources are needed.
Right.
In terms of like, hey, do you have education you can provide? Do you have any ideas on equipment training, things like that? But this is very specific to the EMS agency.
Yeah. I just wondered, I guess, if there was overlap with a lot of the policies. But I will read through it more. Thank you. It's very interesting.
Yeah. I think the team's saying possibly, but I think those, the pediatric hospital recognition program is very specific to what is in the emergency department, staffing and training and equipment specific to the ED, whereas this is really a pre-hospital focus. So this is kind of saying this is the EMS equivalent of the ED recognition program.
Right. Okay. Thank you.
Mm-hmm.
And then Dr. Bradley. Just to add to that point, and thank you. I apologize, Sarah. I don't know if I saw your name correctly, but the objective of this program is to get the EMS side of the pediatric recognition program, speaking to the hospital side of the hospital recognition program. So we want to continue creating collaboration and partnership with those hospitals and our pre-hospital providers. So that will be the opportunity for them with this program. Thank you, Dr. Bradley.
Thank you. There's another question across the room.
Question would be what was the decision or thought process around the 2-year mark? The reason I ask is many of the CON holders have a 3-year renewal process. So was that taken into consideration, or were we trying to be in alignment, or if there's any discussion around that?
Sorry.
That's okay.
Sorry, that's like 2 strings and.
Those of you online are not appreciating the humor of the computer being moved back and forth, but hopefully the audio sounds great for you guys.
So there was much deliberation on the time frame for the recognition criteria, or recognition time of award. We consulted with some of our internal groups here at ADHS, but also our EMSC state partners that already have this project in place. Some of the feedback we received, if it's 3 years, it tends to be a little too long, and then they have a struggle renewing because everything veers off. So the EMSC state partners that have taken the 2 years, they're more apt to reapply and renew, and they find it to be an easier process.
And that also goes along with the recertifications for their training and stuff like that. Is it every 2 year for EMS? So that's kind of where we were looking at it as well. Sorry.
I fully understand. I'm hopefully loud enough. I think to Garth's point or Daniel's point, there are larger entities have a vast amount of employees, so they're doing it constantly. So looking at providing lists or updating lists of people that are taking this training and trying to be in compliance with this, fully support the program and understand what we're trying to do. I think to be successful, we're just going to have to be mindful of, one, the expense associated with it. But again, we don't want to, we're trying to elevate the service, and which we completely understand and are supportive of. I think just being mindful of the total picture and how we're able to do that. Because what I don't want to have happen is create a program and then there's not a lot of buy-in because of I'll call it some of the barriers we're trying to work through. But I also don't want it to be just a rubber stamp for everyone to apply. And I think that's the balance to work through when we're looking across the state of Arizona with the size and scope of providers.
Thank you. And then I see in the chat from Vince Martinez from Northern Region, I agree with the 2-year cycle to be in alignment with the EMCT certification cycle. So we are coming up near the end of our meeting time. So what I like to see, since we do have a motion on the floor to approve, are there any recommended amendments to the program for the approval process? Oh, we don't know motion? Oh, is that right? I was clarifying. So Dr. Maida made a motion to approve, and the second from Brian Smith. Thank you. Are there any recommended amendments to the application process? There's a minor typo that Chief Garcia identified. Got it. Thank you. No worries. All right, so we are committed, like I mentioned, with any program. Certainly, we will kind of look within the first 12 months, see participation and any barriers to participation. So thank you for bringing up those great points. So we will go ahead and take a vote. Is there anyone opposed to the approval as presented? Hearing none. Any abstentions? All those in favor say aye. Aye.
Aye.
Excellent. Thank you. Next, any agenda items to be considered for the next meeting? Call to the public. I will not go through all the upcoming events. I did want to point out one key one, which is the EMS-based hospital medical director seminar that is October 18th in Flagstaff. We are going to have representation from the DEA regarding some base hospital and medication discussions. So please, if you're able, join us either in person or virtually. Our next meeting will be January 30th. I will point out that for 2025, we are off our regular meeting cadence for some of our meetings. So we are not always going to be on the third Thursday of the month. So you will see in January, we are the January 30th. So we are off that normal meeting cadence. So just be aware when you look at your calendar for the 3 meetings for the year. And if I can get a motion to adjourn. All right. Thank you.